All right, Dr. Wynn here, here to kind of have a video to discuss kind of our launch of our highly anticipated and new feature, the differential diagnosis learn feature. You guys might have seen it on the blog. We kind of launched it first on the blog, but this is going to be our video explanation of kind of why we created the differential diagnosis learn button. So a lot of my students always have the issue of picking between, issues with picking between two diagnoses that are very, very similar, right? In their minds, right, they're so similar that, it's a 50-50 question. And I'm sure a lot of students have that same issue. So for the past couple months, me and my team have been trying to create a feature for you guys to be able to learn differential diagnoses and to really dictate between one disease versus another based on, very, very different characteristics, whether it's risk factors, whether it's associations, whether it's acuity or chronicity, or even whether or not, certain kind of scenarios here and there. And so how did we create this? Right. And so our differential diagnoses include multiple things, right? It deals with the clinical aspect of each individual, the highest yield diagnoses that you're going to see on step 1 and step 2. So this is going to not only help you for step 1, but also train you for step 2 for your clinicals. And so the way you think through these clinically and start creating that differential diagnosis early on in medical school will allow you to succeed in the future. So taking a look at our differential diagnosis tool, if you take a look on the left-hand side, it's only released right now for our premium members as of right now. So if you do subscribe and get premium, it's going to be on your left-hand side, the learn portion of the bar. And then as of right now, this is our first version of it. And so bear with us as we continue to develop and make it more sophisticated in version 2 and 3. But as of right now, right, we have a list of the first 100 diagnoses of the highest yield for step 1 and step 2. And so as you can see here, our first 100. In the future, what things to come is obviously we're going to have a tab to say, if you've done the card or not, or if you haven't seen the card or not. Okay, those are going to be important things in the future. Another thing is you'll be able to pick based off of either your rotations for your second year or, your systems for step 1. And so you can go through each system as you're learning for MS1 year and MS2 year, or while you're studying for step 1. And also on top of that, right, during your third year clinical rotations or you're studying for step 2, you'll be able to study those diseases, right, that deal with your specialty, that, your rotations that you're going through, or like I said, your systems that you're focusing on during that time during medical school. But let's take a good look of one of these as an example to kind of see, how we utilize, multiple active study modes such as high yield notes, differential diagnosis tables, simple questions, USMLE 1 questions, USMLE 2 kind of type of questions, and of course flashcards, all of that in one sitting to get you multiple repetitions. Because learning a disease process or a diagnosis is all about repetitions. Seeing something 6, 7, 8 times in a various different modes will allow you to obtain the information a lot faster. So let's go through the acute respiratory distress syndrome. So you see kind of 1 out of 32 slides or kind of, study modes, right? So the first one, you're going to get kind of the high yield note on acute respiratory distress syndrome, the chief complaint, if it's acute or chronic, most common symptoms, specific symptoms, risk factors, specific lab values, imaging, and treatment management. And of course, at the very end, what we're trying to build is, your differential diagnosis, to distinguish this from very similar disease processes or diagnoses. Then once you click next, right, then you're going to go through some simple questions based off the high yield notes. And so this is kind of your basic recall, right? And of course, I'm going to click random things to kind of go through it, of course, so that you guys can see the next study modality. So, first couple questions going to be relatively, simple, right? Based off of those high yield notes. And, as I'm showing you guys, I'm not really reading through these, right? But the next kind of mode is kind of a step 1, step 2 style question. Reading through this is going to be your first order question, right? And so, reading through it, you want to work through it clinically, but of course, the answer is going to be kind of the card that you're dealing with, but this is preparing you of how to read through questions, how to think through it clinically, right? And so you see a question right after you read a high yield note. And then, of course, right, then it becomes a little bit harder. You get a second order question. And of course, I'm not working through it. It's just kind of a demo right now, right? And so you get kind of your second order tougher questions to do. So kind of helps you prepare for those trickier, harder questions, right? So you get a couple of those so that you can practice. And so this is helping you with that repetition, seeing basic recall from a high yield note, seeing basic questions, right? So that you can recall those high yield notes, then starting to see step 1, step 2, USMLE style kind of questions. Okay, and now you start getting into the nitty gritty and comparing, acute respiratory distress syndrome versus COPD exacerbation, which is very similar. So you can kind of see them back to back, right? The symptoms, the different onsets, right? Risk factors, diagnostic criteria, right? Additional information and main clinical symptom differences. So this is key to kind of see them back to back so that when you see it on a test, you can say, oh yeah, I remember that it's a lot different, COPD exacerbation versus ARDS, right? And so students miss those questions quite a lot, but if you see them back to back, and then after you read those high yield notes, then you'll be able to see, okay, so another questions from those, right? Those notes, right? Very simple things so that you can start your recall. And here's kind of the flashcards, which you can start looking at things broken down a little bit more in a different mode of studying so that you don't get a little bit too tired or worn out or burnt out from studying. So here's kind of our flashcard feature here, right? So a couple flashcards on it, right? And then you go to the next thing, ARDS versus cardiac pulmonary edema, right? So same kind of ordeal, right? And then, a couple questions here. From that high yield notes, some flashcards, right? Some questions, another flashcard, right? And then, you're going through each diagnoses, the differentials that is so close to, so that you can know the differences, so that you never miss a question on ARDS, right? And so you want to go through kind of this whole, we call it a whole deck, right? Diagnosis deck, so that, you'll never miss it. And so that's kind of the whole idea behind this new differential diagnosis tool. So this is one of the key features, is that you get multiple modalities to study, so you never get burnt out. You get to know the nitty gritty details that separate it from something that's very similar to it, that of a chief complaint, right? And so not only will it help you on step 1 and step 2, but also on your rotations when you're talking to patients, when you're figuring out, okay, what are the top 5 differentials for this chief complaint, right? And then being able to present to your attending and say, hey, I think it's more so this versus that. So this will allow you to do that. So we're very, very excited about this new differential diagnosis tool, and I hope you guys like it too. Please let us know on any feedback. Of course, this is the first iteration, so anything that you guys give us feedback, we'll take it to consideration to improve and make this better for you guys, because, I love tutoring and I love teaching, and I want to make studying medicine as efficient and as fun as possible.